Herniated disc, is an MRI necessary? By Dr. John D. Carlson, Austin chiropractor. Herniated disc treatment with spinal decompression, is an MRI necessary? Hello, I'm Dr. John D. Carlson, Austin, Texas chiropractor. Today I'd like to answer the question, do I have to have an MRI to determine if I have an injured disc? Well, if you're looking to see the disc and image the disc and have a definitive answer, an MRI or CT scan would be necessary to determine if you have a herniated disc. However, there are many tests that we can do on a clinical basis to determine whether or not you have a herniated disc. 90% of the time when a patient has pain radiating down the leg below the knee, that's due to a herniated disc. Other tests in the lumbar spine that would help you determine whether or not you have a herniated disc would be Bechtereau's test. Bechtereau's test, the patient's just sitting on the table, they raise both of the legs straight out in front of them. If that generates pain into one leg or both legs, more than likely that's due to a herniated disc. Valsalva's is a test that's positive both for the neck and also in the lower back disc protrusions. Patient takes a deep breath, they hold it in, and then they bear down and kind of strain. If that causes pain in the neck, radiating the arm, or in the lower back, radiating down the leg, that also can indicate a herniated disc. A patient would be laying on their back when the doctor will take their leg and raise their leg up straight. And as we get further up, put some more pressure upon the sciatic nerve. When that straight leg raise generates pain radiating down the leg, oftentimes that's due to a herniated disc. Another test while the patient's laying on their back in the lumbar spine to determine if they have a herniated disc is called Milgram's. For a patient to do Milgram's test, the doctor just asks the patient to raise their heels up off the table about 6 inches while laying down. Most herniated disc patients can't do that, or if they do, they can't hold it there for very long. Their heels kind of collapse and it's due to pain radiating down their leg. Another test that helps us understand if you have a herniated disc in your lumbar spine is a leg traction test. A leg traction test is where the patient's laying on their back, the doctor gently and firmly pulls on their foot and ankle, distracting the joints of the lower back and putting a negative pressure upon the disc. If that gives relief of pain in the lower back and leg, more than likely traction would help you, spinal decompression would help you, and your condition very well due to a herniated disc. In the cervical spine, a distraction test would be called femoral decompression test, where the doctor just pulls up gently upon the patient's head and neck, and if that relieves pain radiating down into the arm, more than likely that's due to a disc. When the patient rotates their head to the same side and that causes pain radiating down into the arm, that's more than likely due to a disc, which is different than if they turn your head to the opposite side and they have pain. So when you radiate to the same side, more than likely that's due to a herniated disc. One other test, cervical spine, is called a upper limb nerve tension sign. It's when the patient puts their arm up like this with the upper portion of their arm horizontal to the floor. They tilt their wrist back and then they kind of extend their arm to where it's full and tilt their head to the side like I am. That would be an upper limb nerve tension test. And that's a very specific test for a herniated disc. If that causes pain radiating into the arm, more than likely you have a herniated disc in your neck. Doctors should be doing tests to determine if your reflexes, your muscle strength, and your sensation in your extremities, your arms and your legs are doing well. If you have muscular weakness, that'd be a sign of a herniated disc more than likely, and you may need to have an EMG, an electromyograph, to determine where the nerve's being pinched, if the nerve's being damaged, and what's going to happen to the muscle. Now, those are tests that can help us determine clinically if you have a herniated disc. Now, in 2005, the November issue of Radiology, the Cleveland Clinic made a statement that MRI was getting no additional benefit for the direction of conservative care. MRIs are not necessary in order to get care started. May be necessary later in the treatment if treatment's not going well, not resolving, or is getting worse, then we certainly want to have an MRI of the lumbar spine and make an appropriate referral. These are ways that we can tell if you have a herniated disc and if indeed conservative care will help you. I hope I've answered the question, do I have to have an MRI to determine if I have a herniated disc? Thanks for joining me here today. I hope to see you again soon, and when I do, I hope to find you healthy and living life to your fullest.
You can also visit my blog at www.drjohndcarlson.com, where you'll find more information and cost-saving internet specials.